Good morning. Thank you all for joining us. I'm Francisco Prieto, MD. I'm a family physician in Sacramento, California. I'm a longtime volunteer for the American Diabetes Association, and I'm the current chair of our National Advocacy Committee. All of us at the ADA were very excited when President Biden urged Congress during the State of the Union address to take immediate action to address the cost of insulin for people with diabetes. The ADA joins the president in this call to action, and we urge every member of Congress to support legislation capping the monthly out-of-pocket costs of insulin at $35 for Americans with commercial insurance, group health plans, as well as Medicare. Making insulin more affordable for those who need it has been a longtime priority and a top priority for all of us at the ADA. That's why we're supporting legislation known as the Affordable Insulin Now Act that's been introduced in both the Senate and the House of Representatives. The ADA has led the way in passing insulin copay caps at the state level, and we now have caps in place in 20 states and the District of Columbia for state-regulated plans. Those have brought economic relief to people who have those plans in those states, but federal legislation has the potential to bring relief to many more people, to many more Americans, because it will include people in all of those private insurance plans that are not state regulated and, very importantly, in Medicare. This legislation can't wait. Congress needs to act now, and we urge all of you to lift your voice, everyone in the diabetes community, to help drive this message to our representatives. We know from surveys that we've conducted that 1 in 4 Americans with diabetes have reported rationing their insulin to pay for other essentials of life like food, rent, utilities, and daycare during the pandemic. And while the pandemic has made that situation worse, this crisis in the price of insulin has been building for decades. The price of insulin has nearly tripled in the last 2 decades, and many people who need insulin to live simply can't afford it. We can't overlook the fact, the impact that this pandemic has also had on people with diabetes. 40% of COVID deaths have been among people with diabetes, and people with diabetes have been disproportionately impacted economically with more severe disease, longer and more need for quarantine. And in some cases, these economic stresses have led to new cases of homelessness, food insecurity. A survey that we did showed that people with diabetes were experiencing homelessness at a rate over 40 times higher than the national average during the pandemic. It's time to pass a national copay cap. This will bring relief to millions of Americans who are being forced to stretch beyond their means to pay for a medication they need to survive. So as I mentioned earlier, we need everyone's help to get this across the finish line. ADA has a tool that allows you to easily weigh in with your member of Congress. You can access that tool on the ADA's Advocacy Engagement Program platform by going to https://diabetes.org/get-involved/advocacy/platform and click on Take Action. I hope that that link will be in the on the page you're seeing. ADA also encourages you to pick up the phone and call your senators and representatives. Let them know how important this legislation is to you. Our Take Action page has draft emails you can use to tell the people who represent you about this issue and about this bill. Importantly, as an advocate, I want to say that you should share your story. If you've been impacted, if you've had to pay the outrageous price that many have had to pay for the cost of insulin, tell that story to your representatives. They need to know. They need to hear that. The time to pass this legislation is now. I hope I can count on all of you who are listening to take a few moments and advocate for people with diabetes. And I think we have time for a few questions. One question that I'm often asked is, why is insulin so expensive? Why has it gone up so much? And I think that There isn't a good answer for that question. We pay more in the US for insulin than any other country. Insulin is not a new drug. Insulin has been around now for 100 years. The last major changes in the delivery of insulin and the types of insulin that we use happened a couple of decades ago. The way that the US healthcare system is structured, there are very few limits on prices. The system is extraordinarily complicated, and especially complicated for people who need a medicine like insulin just to survive. But Congress can do something about that. Congress can set the rules. We're asking them to do that. So one of the questions we're being asked is, who will this cover? And right now, our copay caps have only covered people in state regulated plans in those states that have passed them. The terms have been different in different states. This will cover any plan that is under federal regulation, which is the bulk of commercially insurance plans. But very importantly, will also cover Medicare. People on Medicare with a fixed income often have ridiculous deductibles. And if you've had diabetes most of your life and are using insulin to stay alive, you shouldn't have to decide between that and paying your rent. So private commercial plans, Medicare, and group health plans covered by something called ERISA, the Employee Retirement Income Security Act. Pardon me while I read some of the questions and the comments. I'll remind you, please, put your questions in the chat if you have any. I'm happy to try and answer. So a little bit more about why insulin costs so much. So insulin is not simple to manufacture, particularly the insulin we use now. We use what we call human insulin, and it is a synthetic exact copy of the insulin that's in all of our bodies. The insulin that was originally discovered and used for many years, starting 100 years ago, was animal insulin. It was beef and pork insulin, and it literally came from slaughterhouses and was extracted. We learned in the 1970s how to make synthetic copies of the exact same insulin that you and I produce every day, hopefully, if you have a working pancreas. That's complicated, but in every other country, the cost of insulin is either regulated or, because of market forces, for many reasons, is quite inexpensive, very affordable for people in Europe, in Asia, in most of the world. The US has an unusual pricing situation, but Congress can set those guardrails, as I said. Congress can set the rules and can limit the copay cap for the plans that they regulate, and they regulate many of the plans. Millions of Americans are on Medicare. They would also fall under this cap. So the cost of production is not what's driving this. I had a talk once with an executive from one of the insulin companies. There are really only three major companies making insulin in the world. And I talked to him about the fact that insulin is so expensive at this point. It was just starting to go up. And I said, this is not sustainable. And he told me that they make a profit on insulin in every country in which they operate, but they make an extraordinary amount of that profit in the US. The US does not have any good reason to support the cost of insulin for the entire world. Question was whether this will include different types of insulin, like fast-acting insulin, long-acting insulin. Yes, the specific terms would depend on the wording in the legislation, but we would like this to cover every form of insulin, including long-acting, short-acting, um, and hopefully will include all the prescriptions of insulin that a person needs for the month. For most people, that's two types of insulin. Some people who use an insulin pump only use fast-acting insulin. Um, some people only use long-acting, but most people use both. Also want to mention that those of you who want to volunteer can contact T. Scott at diabetes.org. That's TSCOTT at diabetes.org, and you can help drive this forward. So question is, what about Medicaid patients? Well, Medicaid, of course, is subject to federal regulation, but is also administered by the states. So I don't know what the terms of the federal legislation will be. The final language will be important. We hope that Medicaid patients will be included, but of course, for most Medicaid patients, there are differences from one state to another. Medicaid already pays their insulin. So if you have full Medicaid coverage and you're not required to pay a share of cost, which can be very high, unfortunately, at times, then you're already getting your insulin covered. That's a majority of Medicaid patients. So I want to remind people, please go to the ADA's webpage and take action. Very easy to find. It's diabetes.org. It's a website that anyone with diabetes, I hope, uses regularly. A lot of good information for people with diabetes, and importantly, we ask our advocacy asks, when we ask you to reach out to your representatives, to reach out to the people who are supposed to be your voice in Congress and in state legislatures, we'll put our messages there. I've been asked, how does sharing our story make a difference? So I've been working in advocacy for quite some time, and we go and talk to legislators, to policymakers, asking them to do something for people with diabetes. We've had many issues. Something we call Safe at School was a big issue when I first got involved, and still is in some places, to try to make the lives of kids with type 1 diabetes safe and allow them to go to school like any other child. One of the things that had the biggest impact on legislators was having those children and their parents with us to tell their story. And this is something we hear over and over. What is, why is this so important to you? I had a patient who we diagnosed at age 1 with diabetes in the days before cell phones, before, uh, the kind of access that we all have to each other today. Her mom, who was a nurse, had to quit her job and become a visiting nurse, bought one of the first cell phones, which were devices that were like the size of a small briefcase, and had to travel to her daughter's school every day to give her insulin. So we wanted to do something about the hardships that were placed on kids with diabetes in school. And telling that story had an impact on policymakers because it's a human story. I've been asked about whether people with gestational diabetes would fall under this copay cap. For those of you who don't know, many women develop diabetes during pregnancy who did not have diabetes previously. Many of them have to have insulin and have to tightly control that diabetes to keep the fetus, the baby, healthy. The answer to the question is yes. People with gestational diabetes using insulin, anyone on a commercial insurance plan or a group health insurance plan, would be covered by this legislation. And if you're a pregnant woman who's had to use insulin to keep your baby healthy, that's a story you should tell. Uh, Question about, will the type 2 injectables fall under this category? So under this legislation, no. We are working to address the cost of other medications and supplies as well, and that's been a focus of our advocacy for a long time. We've been asked, why just insulin? Insulin because people with diabetes, particularly people with type 1 diabetes, need insulin just to stay alive day to day. We also support the effort to bring the cost of other prescription drugs down. People with diabetes spend much more of their income than anyone else, uh, more than twice the national average, on the cost of medications, including insulin. We want to bring those costs down. We will support legislation, and we've been supporting legislation to bring those costs down. That's not in front of Congress just yet, but we hope it will be very soon. Okay. I think we're coming to the end of our time. I hope that you'll get involved. Anyone can send an email, can send a text, can make a phone call, raise your voice. If you want to get involved, please contact raiseyourvoice@diabetes.org. And again, diabetes.org is the homepage for all our advocacy efforts and for information for people with diabetes. I want to thank all of you who've joined us, and hope we'll hear from you soon and have your support. Thank you.